All right. Well, so for those of you who are, I'm Dr. Bill Sopchak here at the Sopchak Natural Health and Wellness Center, and today we have a lovely guest with us, Dr. Tammy Gutierrez, and she is a functional medicine specialist. She's a medical doctor who worked at the university hospitals in Orwell for somewhere around 8 or 9 years, and then life took some twists and turns, and she started moving down some different paths. And I'm going to let her tell you a little bit about that, and also how what she does and how she helps people. So I'm very pleased to have her here, and everything we try to do here is all in a natural, healthy way. And so this is just another person that we are partnering with to help us in those areas where we can't do things. So Tammy, I'll let you take it away.
Thank you. Awesome. So as you mentioned, I was a regular family doctor, first at Ohio State and then as part of UH for a while. But I kind of got tired of not fixing people and just writing a lot of prescriptions. And I had some personal experiences, including about 9 years ago, I actually had vascular cancer, a really rare type of cancer that really showed me everything that my medical school education didn't teach me, including how powerful lifestyle and diet interventions could be to actually heal the body. And so I really started branching outside of what I had learned in med school and really started feeling my best, and also really started being able to change things for my patients in a very different and more powerful way than I had been given in med school. I still am very grateful for everything that I learned in my MD training, and I still use those things as they apply or are appropriate. But really, the body is much better at healing than we are. And so what mostly I discovered is that what we need to do is we need to help people find out why they're sick. Instead of just label clusters of symptoms, we need to actually understand the root of it, which is really where functional medicine comes in. And so I found functional medicine years after my own cancer journey, but it really helped me put the pieces together and actually understand the underlying causes. Because if you fix the underlying causes, then you usually don't have to worry about the labels or worry about the treatments that you're giving based on asthma or diabetes or those things. If you solve why you have diabetes, then you just stop having diabetes. And that's way more fun than taking medications for the rest of your life or carrying a label or suffering the consequences. And so that's what I've been doing for the last several years. I tried doing it out in my family practice at Orwell, but that didn't work very well because it's hard to do that in 15 minutes. And so if you really want to dive deep and understand the root of someone's health problems, you really need to get a much deeper dive into their life story and really understand all of the interplay between genes and environment and healthy decisions and unhealthy decisions, and how those things are layered over time to create the situation that you're in now. And so that's what I do with functional medicine. People come in and we go spelunking and we discover what's in their personal story and all the different factors that got them where they are now. And then we start unraveling it as needed to get them back to a truly healthy state and to support the body as it heals. So
it's awesome.
Yeah, it's really fun. It's so much more fun.
So if somebody came in and let's say they had Hashimoto's,
sure.
What kind of stuff would you? You're going to look at, of course, the TSH and all that stuff. But what kind of other things do you tend to find that might surprise people?
Oh, absolutely. So one thing I will say is that Hashimoto's, which is an autoimmune attack on your thyroid, can come from lots of different places. One of the things that's different about functional medicine than how I used to be in Western medicine is I used to have a starting point like, oh, you have Hashimoto's thyroiditis. Here's my guideline. I'm going to just tick down that guideline and do these things on the list. And now I actually start with your maternal grandma and take your entire life story and discover that for you, maybe you had an infection. And that's what triggered your immune system to start attacking your thyroid. Or maybe you have food sensitivities and you can't have wheat or dairy or both. And we have to heal your gut and get your immune system to calm down so that it stops attacking other organs in your system. Or maybe you actually have emotional trauma and we have to heal your voice because the thyroid is part of the throat chakra. And that is a place where things are blocked up for you and you feel disempowered. And we have to help you do that, because until you do, your body is going to call your attention to this area and move you in a bad direction until you're willing to do the work it takes to turn it around. Or maybe all of the above.
Right.
It just depends, right? And so it's very personalized and it's very unique. And I go where the patient's story takes me. Sometimes it even surprises me. Another example I will use is like endometriosis. So I had a woman come to see me because she was having infertility issues. And I suspected from her story that she had some endometriosis. And endometriosis is often very toxic related, but it can also be stress related. So we had started taking a story about, what had happened in her life, and totally crazy. Every place she had ever lived, someone else, like whatever child lived in that house, had been diagnosed with lead poisoning. And so this was in 3 separate houses in her life. And I looked at her and I said, I think you have lead poisoning, right? I think you are having female organ dysfunction because your body is full of lead. And so we got to solve that for you. And we tested her and she was high and we had to kind of help her clean some of that out. And now she's pregnant. So, it's really a journey and everybody's journey is unique. So,
cool.
Yeah.
So I'm just going to keep throwing things at you because there's a lot of people out there who have questions, and if I don't ask you, you're not going to just like throw them out because you're sitting there going, "Oh, there's so many things."
Right.
So, like, how would you handle somebody with, say, polycystic ovary syndrome? The issues there.
Right. So PCOS is almost always insulin toxicity. Right. And so you have to figure out why you're having insulin toxicity. So a lot of that starts in either the gut, or it starts in, again, a high adrenal state that you're just pumping out cortisol, which then increases insulin resistance and sets people up to gain the belly weight and then make their ovaries sort of drunk and not be able to function well. There is often a toxic component there too, but more common with PCOS is really that insulin-driven inflammatory state. And so most often we're healing the gut first, right? And then there are some simple things that help people lose that weight, help turn that around. So we might use a variety of supplements for the first couple months to help shift and move in a better direction, but mostly diet. I have to say I start, although I do use supplements, I start with lifestyle first whenever possible. I don't like taking tons of pills, and so I try to honor that for patients as well, and I try to really help people see the power that their lifestyle choices have. So a PCOS patient would probably go on a diet that's very clean and very high in healthy proteins and healthy fats, but not so high in carbohydrates to help them get that insulin resistance turned around and help them get to a healthy weight and a healthy insulin balance, and really focus on exercise and mitigating that stress level, and then see what's left. It usually doesn't take that long to turn around, actually, once you start giving your body what it actually needed. Depends.
So how do you handle people who, they want to do it, but they don't really want to, I just, with my job and my work or whatever the excuse is, I just can't eat healthy. I do the best I can.
Right. And so I always start wherever the patient is, but I also have a huge advantage in that I have been living a lot of different healthy diets over the last decade. So when I was fighting my own cancer, I used green juice and I used a totally gluten-free, mostly raw vegan diet, which I followed very strictly for several years until I felt like my cancer was fully resolved. I have also had the personal experience of a child with a ton of food sensitivities. And so I ended up learning how to eliminate almost anything that anybody ever has to eliminate and get really good at still making it taste good and still not take a lot of time, because I was still a mom and a doctor during that whole time. And so I have oodles of tricks and recipes and ways to help people get started. Sometimes I think it's really just a lack of knowledge, a lack of comfort or familiarity. And so I really do think that that piece is something I can help people navigate a little better than most, because I didn't just read it in a book. I actually eat it in my kitchen every day. And so I think that is also helpful. But sometimes we start small, and sometimes we start just by modifying what you drink, or modifying how much exercise you get, or picking a few supplements and starting there and then building on it. It's not my job to judge. It's my job to provide resources and to guide. I don't know what happened to Dr. Sopcak. It says we're still recording, so I'm just going to keep talking for a few minutes and see if he's able to join us again. I also think that a lot of times people come to me because they feel like they've had pain, right? Or they've had inflammation and joint issues, or autoimmune attacks on other parts of their bodies. And so really helping people reconnect to finding that way to restore balance, most often starting with their gut, but also helping to regulate the mitochondria, which is an area that a lot of people have never even heard of. And so I like to mention that in forums like this, because the mitochondria play such an important role in our health and in how we feel and in our energy levels and in our moods and in our cardiovascular fitness. And yet they get almost no attention in Western medicine. And so inside each of our cells are basically the remnants of ancient bacteria, and they're called mitochondria, and they're our furnaces. And they take the food that we eat and they turn it into heat and light and electricity for our cells. And the cells in our body that have the highest numbers of mitochondria are the parts that never turn off, right? The ones that need the most power. So that's our brain, and that's our cardiovascular system, and that's our muscles. And so when you think about things like chronic fatigue or fibromyalgia, or even just depression, right? And anxiety or ADHD or autism, things that we don't even talk about being reversible, a lot of that is mitochondrial dysfunction. And so by helping to heal those mitochondria, we can sometimes really turn around things that are just derailing people's life and function. I was talking about the importance of mitochondria, and a lot of people have mitochondrial issues and they don't even know about it, right? They've never even heard of it. It was something that maybe got mentioned in biology class decades ago, and they've never thought that this was relevant to their day-to-day existence. And so that's another space that I feel like I'm often helping people support, right, is that mitochondrial healing, because so much of what we ingest now is full of pesticides or herbicides or antibiotics, and all those things just totally kill and derail our mitochondrial function. And so I think that's another space that people don't realize when they're just tired, or they're just brain foggy, or they just hurt everywhere all the time. A lot of times it's mitochondrial support that they need.
Sorry, I lost you for a little bit. I'm hoping that you're still going. I mean, you're still talking, so it's apparently still going.
It said it was still recording, and it said that Sherry and I were still here. So
that's good.
I assumed I keep going with the recording.
Everything just shut down. My power went out, everything went out, lights went all black, and I'm like, what the heck happened?
Oh my goodness. So maybe the building had an interruption of some kind.
Yeah, something happened because everything went down.
Got it.
So
well, I think we were still good. We were still good.
Good. Sorry, I missed most of the explanation that I finished asking you about, but I'll give you something else to throw out, because it's something that a lot of people have questions about and want to know about is things like not just irritable bowel, but like celiac, because I know you've dealt with issues like that. And is celiac, is it something that can be healed? Or is it just something that you can just control?
Right. So celiac is kind of an unusual situation, because patients with celiac have a genetic predisposition to not be able to tolerate gluten. If their gut and everything is completely healthy, they can often go many, many years without presenting with symptoms. But all it takes is some trigger to tip them into activating that problem, and then they can get very, very sick. And some of them present even as infants, right? Sometimes it's almost immediate, but sometimes they don't present until my age or older with all of the manifestations of it. And so how you express it is very variable, and it's related to how good your environment is and how many other resources you have. And so celiac, the predisposition you can't really solve. You can't make that go away, but you can heal the body enough that it no longer has issues with it. In general, when I have a patient with true, legit, full-on celiac disease, I do not encourage them to ever have gluten again, because it's kind of a time bomb that then they could potentially reactivate. Like they could have a stressful day and not sleep well, and then they might not tolerate that gluten the next day. But
kind of like being an alcoholic, right?
Kind of like being an alcoholic.
Yeah,
exactly.
They have a genetic predisposition. If they don't drink alcohol, they're fine. But once they do.
Right. Right. And not everybody who's alcoholic has the genes for alcoholism.
Right.
And not everybody who has wheat or gluten sensitivity or intolerance has celiac. In fact, only a small percentage of people actually have celiac. Mm-hmm. Gluten is very irritating because wheat is a really strange plant, actually. Unlike us and most other organisms, where, you know, when I got married and we had kids, each of us gave half of our DNA, right, to each of our kids. So they have the same number of chromosomes that we have. But when you take wheat and you cross it with another strain of wheat, not GMO, but just crossbreeding, the children keep both full sets of chromosomes, okay? And so when we take the kind of wheat that we eat mostly in this country, right, not spelt and einkorn and some of these ancient forms of wheat that just have a normal number of wheat chromosomes. But when you look at standard wheat that most pastas and breads are being made from in the United States, it's actually got 3 or 4 times that genetic material, because it's been crossbred with multiple species of wheat over the years to create that finished product. But as a result, your gut has this enormous molecule that it has to chew apart. And unfortunately, our gut is on fire most of the time in this country, again, because we have so many exposures to pesticides, herbicides, antibiotics, and there's antibiotics in our food. It's not even just in our medicines when we take them.
Sure.
And all these things basically create weak spots in our gut. And then anything that's not fully digested, fully broken down, that gets in actually triggers the alarms. You have 70% of your immune system lining that layer in your gut. And so it's there like a customs official to check the passports of everybody as they come in and make sure that they're allowed to be there and that they're not an invader. And these undigested proteins get treated like terrorists, right? They get treated like they're attacking you, like they're an infection. And so then you mount an immune response to that segment, whatever that undigested segment is. The longer and harder to digest a food is, the more likely it is that a piece of it is going to make it through one of those holes undigested and trigger an immune response. Other things that will make you more likely to have a problem with it is if it's a food that's commonly contaminated. So if it's a food like soy or corn that comes with toxins or pesticides most of the time, then again, not only are those things poking holes in your gut, but also your immune system is saying, wow, every time I see this piece of corn, I also see bacterial toxin, because that's how GMO corn is actually modified. And so when you eat GMO corn, you're putting bacterial toxin into your gut. And so your gut says, hey, bacterial toxin, this must be a bad guy. And so corn allergies skyrocketed after they modified the corn. And so, you know, your gut's a learning system. And so all these things then end up creating sensitivities. Most food sensitivities, though, can actually be resolved, right? The celiac is different, but most food sensitivities can be healed by repairing those holes in your gut and helping your gut be healthy. And I know you also do additional therapy to help people try to turn off that immune response, which is, you know, even faster.
But they still have to heal the gut. You know, people ask me all the time, they say, hey, you're doing this allergy desensitization, you know, and it works, but will it come back? And I said, well, it all depends on how healthy your gut is.
Correct, because that's how you made it in the first place, and that's how you'll make a new one.
Right.
And that's what I tell my patients with SIBO, right? So SIBO is small intestinal bacterial overgrowth, where we have bacteria that don't belong in the part of the gut that they're growing in. And so as a result, people feel very uncomfortable, bloated, or painful, or gassy after they eat, especially certain foods that tend to promote the growth of those bacteria. And so SIBO is an increasing problem in our very dysbiotic society. And so many people come to me and they're like, oh, I got treated for SIBO and then it just kept coming back. And it's like, well, that's because you didn't solve the reason you got SIBO in the first place.
Right.
Right? You know, the analogy I often give is if my sink is overflowing because the drain isn't working and the water is on, Western medicine tends to come in and mop the floor, right?
Right.
And that's great to a certain extent, right? It's nice to not slip as you walk over to the sink in order to try to fix it. But you should at least turn the water off. And preferably, if you would like to have the full function of your sink back, you have to figure out why it's not draining.
Right.
So that then you can turn the water back on if you want to without causing puddles. And you don't have to keep mopping all day. And so that's really, you know, my approach is to say, okay, fine, we can turn off the water, we can mop the floor, but we also need to look at what's in the drain. Why is your drain clogged? Why does it not function? Right? Well, it could very well be, you know, but the treatment's very different if you have a 5-year-old that shoved a toy down the drain, right, versus if you have somebody pouring oil down the drain and it's all just gunky and clogged in there, right? So the remedies are going to be relatively obvious once you figure out what it is that's clogging the drain.
Right.
And so the remedies are pretty obvious in your health too, once you figure out what's actually wrong, right?
Awesome. It's interesting that, and you made that comment about I didn't know that about that they held both, when they modified the wheat, that it holds both.
Yeah.
Because I have a lot of patients that will say, oh yeah, I went to Slovenia or I went to Italy or whatever, and I ate and I was fine. It didn't bother me at all. Yeah. And that's because here in the United States, everything's genetically modified, and over there, it's not all that way because Monsanto has had their way over here.
Right. Well, but even with the wheat, even pre-GMO, we were up a creek because this was even just the crossbreeding, even before they made a GMO. The GMO has added even more irritation and complexity. But, you know, the wheat we've been eating in this country has not been super great for a long time, even before the people in the genetic labs at Monsanto got their hands on it.
So how did they crossbreed it?
So they just would take two different wheat strains and crossbreed. Right? Farmers have been doing that for millennia. Right. It's only wheat, to the best of my knowledge. I'm not aware of any other, at least food product, that does that bizarre thing where the child strain keeps genes from both sets of parents, like both full sets of parents. It's kind of a bizarre situation, but it makes it pretty easy to understand why wheat has gotten so much harder to digest, right? It's a lot of genetic material, a lot for you to break down.
It's awesome. So yeah. What would it be like for a new patient to come see you to you know, let's talk about that so people can understand how that works.
Right. So the first visit is nearly always just talking and taking that big long history, which tends to take at least an hour, right? It tends to take an hour or so. And we start with your maternal grandma and we follow all the way through. I try to have people, if they can, fill out some forms that I have, you know, that they can get access to online, or that if they have filled out your forms, then that works too. But some kind of a data collection first, so that I have a running head start on getting some of the easy stuff on there. But then we're really taking the story of the life events and the health events and seeing how they kind of mesh together and understanding the genetic backdrop of all of it. And then that helps us see where are the threads that got you started on your path to wherever you are now. And so at the end of that, then we come up with a plan, right? We come up with an idea of like, okay, it looks like you have a ton of mitochondrial dysfunction and some insulin resistance. And so here are the things that you can do with your diet, with your exercise, with your sleep, with your relationships, with your stress management, possibly with supplements, right? Here are the things you can do to try to help turn that around. And I give people that comprehensive sort of plan or approach. If there are tests that need to be done, then we would do them. But I will be honest, although a lot of people just throw lab tests at you right away, I tend to start with lifestyle modification unless I'm really just not sure, right? So if someone came to me and I said, I don't know, you might have a thyroid problem, I'm not sure, well, then we're going to check it. But most of the time, more than half of the time, I don't even need a lot of lab tests at the beginning. I mostly just need to get started. Like, these things are clearly things you could do to feel better. Let's do those for a month and then see where you are. If 80% of your symptoms are better, then we'll just take the remaining 20% and see whether we need additional lab tests or additional things to try to help tweak those. But it's really impressive how much lifestyle will alter things, and for many people very quickly. And so I've just backed off over the years, testing a bunch of things. Like, let's say I think you have the beginning of diabetes, but your diet is horrible. If you're willing to change it, I'm actually not going to check you right now, because I don't actually want to label you with diabetes on a chart that you might carry forever, that's going to impact your life insurance premiums and your ability to apply for disability insurance and all kinds of things, if I can make it go away in 6 weeks.
Right.
So, that's what that would look like usually. Yeah.
Cool. All right. And so then anybody who's interested, they can contact either you or me, and we'll be happy to get you hooked up with Dr. G. She's right now, pretty much everything is, are you still virtual right now?
I'm pretty much doing everything virtually at this moment. If somebody really needs a physical exam piece, like we talk and I'm like, wow, I really need to push on your belly, or wow, you've got this weird rash and I really need to see it in person. I have a space where I can actually see people outdoors under a grape arbor. And so I just basically arrange like a 5 or 10 minute quick drive up, do the exam, go home. But especially because that first visit is so long, like just so long, it's a really long visit, and often people are pretty emotional. So things like not touching your face get kind of challenging when you're crying about some trauma that you've experienced in your life that we have to talk about. And so in general, it's just been easier for everybody to do that online. Plus, one thing the quarantine kind of opened up for me is when people are home, they can answer questions that they sometimes can't answer for me in their office. Like, they can go to their cupboard and pull out the supplements they're taking that they didn't think to bring with them, or they can go look something up. Like, it's actually been kind of helpful to have access to that sometimes.
Good.
Yeah.
All right. Well, I don't know if there's any questions out there other than what I've decided to throw at you. I don't know if there's anything else that you wanted to talk about. You know, do you have something that you feel is like this is kind of like my specialty? I really like to. This is something that's, you know, a lot of people have it. It's easy to fix if you do it the right way, and I kind of love doing this one. Or
sure. Well, I really just love people, right? And so since I don't have a particular disease that I really specialize in, it's really about people and helping them unravel. I would say that the one thing I do love that I don't get to do as often as I used to is helping people heal their children, right? So I used to see kids a lot, and I don't see kids as often. And so there's so many things in children, like chronic constipation, that we just medicate the heck out of for no reason.
right.
And without healing the actual reason for it, right? Or ADHD, like people put their kids on crazy meds because they don't know that that's a mitochondrial disorder. And if you support their mitochondria and heal their gut, that most of the time they don't have to have ADHD anymore, and they can be fine. And so I feel like the pediatric side of things is something that I would just put a plug in, that a lot of times investing a little bit of extra homework and powering your lifestyle approach to parenting can actually make the whole process so much better for everybody and lay the groundwork for a really healthy adulthood that I worry about sometimes for this current generation.
Right. Well, hey, I really thank you for coming on today to talk to our patients, to give them an idea of another way to get healthy and to enhance their lifestyle, because, you know, it's all about living life to the fullest. And if you're dragged down by different things and it sucks your energy out, then the people that you come in contact with, you're affecting them as well. So However, on the same token, if you're full of energy and everything's going great, and now you're affecting people all around you in a whole different way. So I really appreciate your coming on today. I don't know if you have anything else you wanted to tell us.
No, I'm just excited. I super appreciate getting to be a part of your process. Right?
Cool. Awesome. Well, thank you so much. I was just looking to see. Look at here. I got to put glasses on to be able to read the screen. Can you fix my eyes?
Well, some of that's a growth thing, right? Your lens never stops growing.
Right.
That's why sooner or later your arms are not long enough.
I don't have that problem. It's not a length thing. It's just a blur thing. They're just starting to blur.
But if you step back, it doesn't get better?
No, not really.
Okay, well then there might be some phytonutrients that you need.
There we go. We'll have to talk.
That's right.
All right. I'll be giving you a call here in another day. Or maybe actually after we get off, I'll call you.
There you go. Well, I would be happy to help you. And awesome. I hope that everybody who listens to this whenever, that you all are having a wonderful week and getting out and enjoying the sunshine.
All right. Well, thank you so much for coming on. Hope everyone had a great time, and everyone who sees us now and in the future. And God bless and have a great night.
Thank you.
All right. Take care.
You too. Bye.
Thanks for being there.
Thank you.
I have to put my glasses on to figure out where I'm going now.
I think you want to hit stop recording.
End.
I got it. Oh, maybe not.